So we wanted to run this masterclass because we really wanted to connect with the primary care community across Greater Manchester. I think it really gives the opportunity to bring the mix of skill, ambition and talent that already exists in Manchester, and gives you some space and time outside of the coalface to really bring some discussion, learn from each other, share ideas, and hopefully bring a bit more motivation back to the workplace for people.
My name's Claire Richardson, I'm a practice manager in Salford, and I'm attending today to just network with my peers, find out how other practices are working, and to support the Peer Ambassador Karina Kapoor, who is working in Salford.
I think there's been a lot of change in general practice over the last 5 years. I think there's a rapid digital transformation in primary care, and there's a lot of anxiety that's going around this. Greater Manchester is obviously trying to spearhead the B Corps and see something that is really at the forefront of everybody's mind in general practice and what the future is going to look like. And we really want to try and help people understand that, reduce the anxiety and make them more au fait with the data that's available.
Really enjoyed coming today to learn a little bit about capacity and demand and what help there is out there available for practices that are struggling. I really enjoyed hearing about the various dashboards and understanding some of the advantages of seeing not just your own data but how you can compare yourself with others, so that we can develop that into discussions inside the practice itself before inspectors come in to see us. I also really liked the session on how we delegate tasks to different teams of people. There was a discussion how different practices are doing it, but actually I'm going to take that back to the practice to see how we're doing it and see what the best ways are, and ensuring that we're using our staff to the best that they can be. Really.
Interested to have a look at how other practices and other main leaders in the primary care space are doing what they're doing to a really high level, as well as the main B Corps elements that are being discussed, particularly around the neighbourhood plan. I was really impressed to hear the level of good work that's going on in a lot of the practices. I think it really speaks to have so many great speakers who've really got a good fundamental understanding of the essentials, as well as some of the more fringe aspects where other colleagues can really further their best practice.
So been really excited by what's been going on today. Participants have really embraced everything that's been talked about, and it's clear that there's been a lot of learning. What do we hope going forward? That they do use some of the tools that we've given them today in practice, but actually reach out to us as peer ambassadors so that we can actually come and give you that support that you need going forward and help you thrive and stay healthy, delivering what we know we do best, which is look after our patients.
Put it together because we were aware there was quite a lot of learning that people could do from each other. I'm always excited by how much energy there is in a room when you get a load of GP staff, practice managers, in terms of how happy they are to share what they're doing and to learn from each other, and that's been kind of shown itself today big time. So it's been a really great event.